I'm Dr. Choll Kim, and I would like to talk to you today about a very common problem in the practice with my patients that have really bad buttock and lateral hip pain. And I'd like to explain to you why I see that so commonly, why it's so painful, and what to do about it. The most common cause of this type of pain in my spine patients is really due to 4 sites that are the tendon attachment sites to all the muscles that stabilize the back and the pelvis. The first area is the PSIS, also called the sacroiliac joint. That's where the butt dimple is. Second area is deep inside your butt cheek, where the gluteus medius, gluteus minimus, and the piriformis muscle is. The third spot is on the lateral side of the hip. Right here, it's the bony prominence called the greater trochanter. That's where the IT band and all the butt muscles attach. And finally, the fourth spot is the IT band. That's the dense collagen tissue that connects and stabilizes your pelvis and your thigh muscles and connects the greater troch, the bony prominence, where one of the bony attachments are, to the lateral aspect of the femoral condyle, the end of the long bone of your thigh. Bony attachment parts are where all the muscles of the spine are attaching to keep you upright and allow you to walk, and in the middle of stance phase, when you're standing on one leg, prevent you from falling over to one side or the other. So you can imagine how much stress goes through there. And in fact, if you ever saw somebody with the defect in the hip abduction mechanism, a classic example would be a patient that had a hip replacement that has a detachment of their piriformis muscle to the greater troch. When they walk, they will walk like this and lean way over, because when you don't have that muscle tendon complex to hold you upright, you will fall over like this. So the only way you can walk without falling over in the absence of that hip abductor mechanism is to lean way over. The point being that the attachment forces to all those bony attachment sites are very high to begin with in a normal person. Now, if you have back problems and your subconscious brain is trying to protect your back by overworking these pelvic muscles and thigh muscles to compensate for your back, guess what happens? After a while, the tendon bone complex, in other words, where the tendon grows into the bone so that the muscle can pull on the bone, that connection starts to get inflamed, probably due to little microscopic tears that overall clinically is not that relevant, but it becomes very painful. It's like a bone pain. So a lot of people will say, if I lay on that side or somebody pushes on that area, it feels like somebody's sticking a hot poker in there. It's that painful. Luckily, it's not dangerous, even though it's very painful, and the treatment for it is relatively benign, although challenging to pursue. And that's basically non-operative treatment. You want to get all these muscles stronger, more limber, and you want that bone tendon complex to be tough so that it doesn't develop microscopic tears, get inflamed, and then go down this vicious cycle of chronic inflammation. So the vast majority of patients that have these severe tender areas is because you're trying to compensate for a back problem and you don't know exactly what you're doing, and we never exercise these muscles, and the treatment for that involves really a really good exercise program, and there's lots of exercises that we can do, and I'll show you those as well. The treatment for these types of really painful musculoskeletal complaints, which I generally tend to consider as a form of tendonitis and chronic inflammation, really boils down to non-operative treatment. I have a video called the chair exercises video that involves some of the most basic exercises, but here are the things that involve the treatment. The first is you want these tissues to be supple and flexible. So the first thing that we do is we want to do a variety of stretching, massage, and rolling exercises to try to get those muscles to be relaxed and limber. Secondly, you want those muscles to have good strength and coordination. It's not just about strength, it's also about coordination. So somebody that is really good at those exercises, when they do it, they can practically just do it with standing on one leg, and it looks like they're not flailing around. If you don't do exercises like that, or you're uncomfortable with that, you may just feel really awkward doing those exercises. You want to get to the point where you're comfortable activating and firing those muscles to get them strong and coordinated. And then finally, you want good blood flow. And the way to get good blood flow is to be limber, to activate those muscles, and to have a very good heart and a very good circulatory system so that as your blood flows throughout your body, it brings in oxygen and washes away lactic acid, for example. There's lots of exercises, but the best way to start out with is usually having a physical therapist that's really good, working with you to find the exercises that are perfect for you, because there's no one exercise that works for everybody. We have to find the one that works for you. And every once in a while, if we need to, we will do targeted steroid injections in each of those areas, because sometimes the body needs a little bit of help to break that vicious cycle of chronic inflammation. I hope that gives you some explanation as to why we see this problem a lot. Hopefully it reassured you that even though it's very, very painful, it's not anything that you should worry about, because it's not anything dangerous, hardly ever needs any kind of surgery. Sometimes it needs an injection. And by knowing this and encouraging you to keep doing activities, sticking with exercise programs, and going through the extra effort to find a really good physical therapist to find the perfect exercise program for you is the best way to solve these pesky tendonitis problems. We're here to help, so if we can do anything to expedite your recovery, please let us know. And otherwise, best wishes for a speedy recovery.